you may not be ready for fasting, because that could actually move you into hypoglycemia, which could be very, very dangerous if you're not mindful about it. Now, I know all this sounds simple, but this is what has helped us reverse hundreds of thousands of people's diabetes. Simplicity. Absolute simplicity.
जो लोग डायबिटीज से सफर करते हैं, क्या वो लोग फास्टिंग कर सकते हैं? जानेंगे लाइफस्टाइल कोच और न्यूट्रिशनिस्ट ल्यूक कोटिन्यो से।
Yeah, it's simple. Number one, forget about intermittent fasting unless, number one, if you're a diabetic. Do you believe you can reverse your type 2 diabetes? If you don't believe it, you're going to be a type 2 diabetic for life. Because as I speak to you right now, there are hundreds and thousands of people who have reversed their type 2 diabetes and are off medications. Their doctors have pulled them off the medication because they're fine. Number one, sedentary lifestyle. You need to move from sedentary to active. There is no negotiation over here. Number two, you got to improve your sleep quality, because it is during sleep that inflammation, hormones, balance. People say, what does hormones have to do with diabetes? Everything. It's a hormonal disorder. Insulin is a hormone. Number three, your stress levels. A little stress is great, but if you're constantly stressed and angry and negative, your blood sugar levels are going to be high. So you have to work on your stress levels. Number four, your food habits. Stop eating so frequently. You don't need to eat so frequently, because every time you eat, your blood sugar levels are fluctuating, right? Number five, the kind of foods that you're eating. Yes, you need to eat the right amount of fiber. You got to stop white flour. You got to stop gluten. You got to stop dairy, period. They're inflammatory foods when you already have an inflammatory disease. So you get back to a very simple regime of whole foods that have your fibers, your proteins, and fats. There's a very simple tip that I give everyone. There's a flow of eating. If you have a plate in front of you, what would you eat first? First, you will eat the raws, like your salad, maybe your cucumbers, your carrots. Then you will eat your cooked vegetables. Then you will eat your protein. And last, you will eat the carbs. But in India, most people do it the other way around. They have the carbs first, which is a sugar dump, spikes. But when you eat the way, we call it the UK lifestyle flow. Yeah, you can be anywhere in the world and you can still follow the flow. Because when you follow this flow, there is not going to be a sugar dump in the body, which means your blood sugar levels have the possibility to get better. If you're diabetic, after every meal you eat, you should be walking for 10 minutes. Not a brisk walk, just a light, casual walk. Now, I know all this sounds simple, but this is what has helped us reverse hundreds of thousands of people's diabetes. Simplicity. Absolute simplicity. It comes down to pure lifestyle. Now, when it comes to fasting, of course, diabetics can fast, but there's a disclaimer here. If your blood sugar levels are so bad and you're operating between hyper and hypo, you may not be ready for fasting, because that could actually move you into hypoglycemia, which could be very, very dangerous if you're not mindful about it. So once your levels are in control with your medication and stuff, then you start fasting 12 hours. Easy, do 13, do 14, and make it a habit. Automatically, your HbA1c, your blood sugar levels, your insulin resistance will start to improve.